Okay, so last time we really talked mostly through the period about the upper extremity, so the pectoral girdle and the arm. But what we didn't get to is the question. So here's your first one. Which of the following muscles moves the scapula? All right, 10 seconds. All right, quite a spread on this one. I know y'all haven't studied your muscles yet, but A is the correct answer. The trapezius is the big square-shaped muscle in the back, and it gets its name because if you look at the back of a person, you'll see a shape like this, particularly in a muscular, physically fit person. That sort of looks like a trapezoid. So the muscle got its name trapezius. And one of its prime functions is to move the scapular spine, which is right here. The trapezius is also a major player in extension of the head. So, when we walk around normally, our head is up. The trapezius participates in that. It holds the head up, and it also pulls the head to the left and right as well. All right, another one. The rotator cuff muscles. What is true about them? Bless you. Tis the season for colds right now. All right, so the best answer there is D. The rotator cuff muscles actually hold the head of the humerus in place against the glenoid cavity of the fossa. Now, in some ways, you could say that B is true. Attach the arm to the thorax, but there is definitely a better answer, more specific answer than that. The reason that it's called the rotator cuff, though, it's not called the glenoid cavity cuff or something like that. And it's these muscles, in addition to holding the arm or holding the humerus in place, they do move the humerus too. And all the movements are rotation. So internal rotation and external rotation are also participated in by the rotator cuff muscles. But why are they important? Because they hold the humerus in the correct position. Without them, or if the rotator cuff muscles are weak, the shoulder will have a tendency to slip out of joint or out of alignment, and that can lead to arthritis, pain, bursitis, things like that. All right. So which of these muscles flexes the wrist? Well, I've gotten an overwhelming response here, so because all of you picked E. which is correct. Flexor carpi radialis. So this is a classic example of, okay, you haven't studied the muscles yet, right? Because you're not going to be tested on it for a few weeks. But yet you all still got the correct answer. Why? Because the name tells you what it does. You know, as long as you know that carpi is wrist, flexor carpi, well, that's going to, you know, flex the wrist, and radialis tells you it's on the radial side. So do look over that. I gave you a long list of root words that are found in muscles, you know, about location and shape and size and things like that. Look over that, particularly when you get to studying the muscles, and the words won't seem so foreign. You know, you'll understand what they mean, so it won't be just memorizing strange strings of characters. All right, so onward to the lower extremity. All right, so some of the largest muscles in the body by weight, in other words, just by sheer mass, are the gluteal muscles. So we find these muscles covering the posterior and lateral surfaces of the pelvis. You know, so in lab, we've all seen the pelvic bones now. You know, they have that sweeping crest that comes up. Well, that's not just for looks. That's where the gluteal muscles attach, on those broad, flat places of the pelvis. So the gluteal muscles are the primary hip extensors. So hip extension is straightening the trunk and the hip together. So when you're standing at attention, your hips are extended. If you're kicking a ball, your hips are flexed. So those are the two motions. And then if you point your foot behind you, that's hyperextension, because it's passed straight and on to the other side. And when we're walking, hyperextension is part of the power stroke. So we move our bodies forward by hyperextending our hip, which pushes the trunk forward. So it's one of the important power stroke steps of in walking. The gluteal muscles also participate in abduction. They pull the legs in towards the midline, and this is important because the way our bodies sit in terms of how the mass is balanced, the legs would have a tendency to spread out. You know, we would have a tendency to do the splits, essentially. So one of the roles of the gluteal muscles is to hold the legs underneath the body so that we don't do that. You know, one of the ways that if somebody goes unconscious standing up and they have slick shoes, you'll see their legs spread apart. And that's because without the gluteal muscles holding them in, that's one of the things that happens. And then off to the side, we have this muscle called the tensor fascia lata, which is right here. All along the side of the leg is a very dense connective tissue, almost like a tendon or a ligament, that runs from the top all the way down to the ankle. And what this does is it helps to stabilize the leg, particularly when we're standing, not walking, but standing. This tensor fascia lata tightens, and essentially it makes the leg like a column. So, you know, we don't have to put in energy to stand straight, or at least not as much as we would have. So the tensor fascia lata sits on the side. It stabilizes things. All right. So those are hip movers, which is motion at the femur. So all of the muscles that move the hip, here we have. So moving the femur with respect to the pelvis. All right, so we have the gluteal group. The gluteus maximus is here. It's the largest one, and its fibers run from the sacrum towards the femur there. Now it's been cut in our picture, but before it's cut, it looks like that. Underneath the gluteus maximus is the gluteus medius, and its origin is more superior, so it kind of angles down a little bit differently. Underneath the medius is the gluteus minimus, and its fibers go pretty much the same direction as the medius fibers do. And then the tensor fascia lata you can see better from the side. And then for flexion, so these are all hip extensors and hip abductors. So they straighten the leg and they keep the leg under the body. The Iliopsoas group, these are the primary hip flexors. So when you kick a ball, that's your iliopsoas muscles at work. Also, when you bow or you bend at the waist, the iliopsoas works there too. Now, sometimes you'll see this muscle referred to as one muscle, sometimes two. But it's a muscle that comes from the inside of the femur, and it attaches to the vertebrae on the inside. the iliopsoas is kind of unique because it's a muscle that is more inside the body than it is outside the body. In other words, it really is in the abdominal cavity. But that's the only place to put it, so to speak, and get it to do what it needs to do. So the iliacus muscle is the long, skinny one, and then is the flat, broad one that attaches to the iliac crest. And then the psoas muscle is very round and attaches there. So the hip flexors. And then the hip adductors, which bring the legs underneath, are these are not all on your list, but the pectineus, the brevis and longus and magnus, and then gracilis. So there's a whole package of muscles here that keep the legs underneath the body. All right. And I think I misspoke. I think I talked about abduction. The gluteal muscles, yeah, it's not abduction here, it's adduction. Keeping the legs underneath the body. Sorry about that. All right, so let's look at a movie or two about these big, important muscles.
It's the large, fleshy muscle that
Gluteus maximus
of the buttock. The origins of gluteus maximus are from the posterior ilium, sacrum, coccyx, and the sacrotuberous ligament. Some deep fibers insert onto the gluteal tuberosity of the femur. However, the majority of the fibers insert onto the iliotibial tract of the fascia lata. The gluteus maximus is the most powerful extensor of the thigh at the hip. It also assists in lateral rotation of the thigh. It is innervated by the inferior gluteal nerve.
All right, so gluteus maximus, why is it one of the biggest muscles in the body? Because it does the power stroke in walking. You know, our primary means of locomotion is the walk. And when walking, the gluteus maximus is moving the heaviest part all the time, which is the femur on the rest of the body. All right, this is the iliopsoas group. So flexor of the hip.
Iliopsoas is one of a group of 9 flexor muscles that cross the hip joint. It consists of 3 separate muscles, the psoas minor, the psoas major, and the iliacus. Psoas minor is quite small, often absent, and is thus considered an unimportant member of the group. The origins of psoas major are from the vertebral bodies, transverse processes, and intervertebral discs of T12 through L5. The fibers run inferiorly and pass behind the inguinal ligament. They then wrap around the femoral head to insert onto the lesser trochanter. The origins of iliacus are from the superior 2/3 of the iliac fossa, the internal border of the iliac crest, and the ala of the sacrum. The fibers converge to insert onto the lesser trochanter with the psoas major tendon. The shared tendon is known as the iliopsoas tendon. With the origin fixed, the iliopsoas flexes the femur onto the trunk. With the insertion fixed and acting bilaterally, it flexes the trunk onto the femur. Psoas major is innervated directly by the lumbar plexus, while the iliacus is innervated by the muscular branch of the femoral nerve.
All right, so primary hip flexors. And when we get into the cadaver lab again, you'll see that these muscles are big. You know, like the iliopsoas muscle, you know, is easily, you know, that big around. I mean, these are very big muscles because they're moving a lot of weight all the time. All right. Okay, sorry, let's wait for everybody up. So that's muscles at the hip, extensors, flexors, primary extensors, gluteal muscles, primary flexors, the iliopsoas. Moving down now, we need to be able to move the tibia and fibula with respect to the femur. So that's the knee joint. So we have flexors at the knee and we have extensors at the knee. So flexion is bending the knee. So the primary flexors in the knee are found posteriorly, and the common name for these are the hamstring muscles. found in the posterior thigh that flex the knee. So we have the on the lateral side. So this is medial, right? This is lateral, because you can see the iliac crest here. So this is the inside of the knee, outside. On the lateral side, we have the biceps femoris, which is a two-headed muscle. And then on the medial side, we have the semitendinosus here, and then the semimembranosus underneath it. And you'll get to see all these in much greater detail in lab, because they really come out better when you can see the model instead of the picture. Some other flexors of the knee, the sartorius muscle is over here on the side, and you can see it better from the front. It's this muscle that crosses the whole leg here. This is the sartorius. Sartorius means tailor, and the reason for that is they call this the tailor's muscle, because in the old days, when a tailor would need to measure a hem or whatever, they would kind of go like this. They would flex their knees and abduct their thighs to get low, and that sartorius muscle does that action in particular. It flexes the knees, and it also pulls the femur out. So the tailor muscle, you'll see it in lab. It's very interesting because it's just a strap of muscle that crosses everything else. So those are the flexors found in the back. The extensors of the knee are found in the front, and this is the quadriceps group. So quad means four, so this is four muscles. The rectus femoris is the one on the top. Rectus means straight, and the rectus femoris has this very straight appearance. And then underneath it, the vastus intermedius, and then on the two sides, there's the vastus medialis on the inside and the vastus lateralis on the outside. So we have extensors extensors of the knee and flexors of the knee. All right, all of which you'll learn more about in lab. All right. What else? So we're going to look at some of these extensors and flexors. I don't remember which one comes first.
Muscles that act on the knee joint form most of the mass of the thigh and are located both anteriorly and posteriorly. The anterior muscles of the thigh that extend the knee are the quadriceps femoris muscle and the sartorius. As the name implies, the quadriceps femoris muscle has four heads: the vastus medialis, the vastus lateralis, the vastus intermedius, and the rectus femoris, all of which converge to insert on the patella, the tibial tuberosity, and the lateral and medial condyles of the tibia. The vastus medialis originates on the intertrochanteric line, the linea aspera, and the medial supracondylar line of the femur. The vastus lateralis muscle originates on the greater trochanter and intertrochanteric line, the gluteal tuberosity, and the linea aspera of the femur. The vastus intermedius originates on the anterior and lateral surfaces of the femur. The rectus femoris muscle originates on the anterior inferior spine and superior margin of the acetabulum. The sartorius muscle, also known as the longest muscle of the body, originates on the anterior superior iliac spine and winds around the knee to insert into the medial proximal tibia. The posterior muscles of the thigh that flex the knee are the biceps femoris, the semimembranosus, and the semitendinosus, collectively referred to as the hamstring muscles. Also included as a flexor muscle of the knee is the popliteus muscle. The long head of the biceps femoris muscle originates on the ischial tuberosity of the pelvis, and the short head on the linea aspera and lateral supracondylar line of the femur. The insertion of the biceps femoris muscle is the head of the fibula. The semimembranosus muscle originates on the ischial tuberosity of the pelvis and inserts on the medial condyle of the tibia. The semitendinosus muscle originates on the ischial tuberosity and inserts on the medial surface of the tibia. The popliteus muscle originates on the lateral condyle of the femur and inserts on the posterior surface of the tibia. Muscles that act on the knee joint exhibit two actions: flexion and extension of the knee. Knee flexion is the result of the hamstring muscles as the prime movers, and the popliteus and sartorius muscles as synergists. More specifically, the sartorius muscle aids in flexion, while the popliteus muscle acts to unlock the knee to allow for flexion to occur. Extension of the knee is the result of the quadriceps femoris muscle, suggested by some to be the most powerful muscle in the body.
All right, so those are muscles that act on the knee. And like was said there at the end, they're some of the most powerful muscles in the body because, at that joint, almost all of the weight of the body has to be moved. If you're standing on your feet, everything above the knee has to be moved by those muscles. So you're talking about some real power there in terms of moving weight around. All right, so from the thigh down into the calf. So the muscles of the calf now are going to act on the joint below them. It's a general rule of thumb in the body that muscles work on the joint that's next distal. So like the muscles just above the elbow are what move the elbow just before the wrist and so on. So down here in the calf, we have ankle extensors and ankle flexors, which we'll get to when we look at the other side. Now, when we talk about ankle extension, what we're talking about is plantar flexion. So you may want to make a little note that ankle extension equals plantar flexion. Because one of the reasons we say dorsiflexion and plantar flexion is because extension and flexion are a little bit weird at the ankle because the ankle starts bent already. So these ankle extensors are going to cause plantar flexion, or pointing the toe downward, standing on the tiptoes. So the two big players here are the gastrocnemius and the soleus. So the gastrocnemius is superficial, so when you feel the back of your thigh and you feel that big muscle tense up, that is the gastrocnemius that you're feeling. Underneath it is a muscle that has a very similar look, and that's called the soleus. Now, we'll get to that in a minute. There's also the plantaris, which is a very thin, spindly muscle, so it doesn't really do very much. So the primary extensors are the gastroc and the soleus. Underneath those, we have some deep extensors. So we have the tibialis posterior and then the fibularis muscles, which I don't believe are on your list. And then, just like in the hands, the toes can move. They don't have the same dexterity that our fingers do, but they can flex and extend. So just like in the forearm, the muscles that move the fingers are found in the forearm. Well, the muscles that move the toes, for the most part, are found in the calf. So we have the flexor digitorum longus that's going to curl the toes. And then the flexor hallucis longus, that's for the big toe. Hallucis is big toe, just like pollicis is thumb. So anytime you hear hallucis or hallux, hallux means big toe. And it hits its own muscles usually. All right. And then, so here's the ankle extensors that we just talked about. The ankle flexors are found on the front of the calf. Now, when you feel the front of your calf, most of what you're going to feel there is bone. That's the tibia. The tibia is a rare bone. It literally sits right underneath the surface of the skin. It's one of the only places in the body where you can sort of poke on bone through the skin is at the anterior aspect of the calf. But off to the side of that bone, there's a muscle laterally, and that muscle is the tibialis anterior, which is the primary ankle flexor. Ankle flexion is dorsiflexion, pointing the toes up. And you can feel this muscle at work when you point your toe up and feel that tibialis anterior. It'll pop out and get very hard, and that shows you that it's contracting. All right. And then for the extension of the toes, this is straightening the toes as well as hyperextension. Most people can somewhat hyperextend their toes. In other words, with your feet flat on the ground, you can lift your toes off the ground. That's hyperextension. And that's from the extensor digitorum longus and the extensor hallucis longus. So just like the flexors, there's two primary muscles for toe extension. Now, the muscles or the tendons that go to the toes for flexion and extension are all connected together. This is one of the differences between the hands and the feet. You know, we can choose which finger we flex, you know, like when we type. You can't, most people anyway, cannot do that with their toes. In other words, you can't just flex one toe. You have a tendency to flex them all at once, or big toe and all the rest of them. And that's because the tendons are sort of attached together. So when one flexes, they all flex together. One of the reasons we can't type with our toes. All right. So ankle extension or plantar flexion is also a power stroke. You know, just like hyperextension is a power stroke in walking, ankle extension, plantar flexion is a big power stroke in jumping and sprinting. So, you know, when you go to sprint, one of the first things that happens is you come up on your toes, right? You know, you don't put your whole foot on the ground like you would when you're jogging. You get up on your toes and you sprint. And the reason for that is the gastrocnemius is a very fast pulling muscle. In other words, it can pull very quickly with a lot of force. So using that muscle, we can run faster, but we can't run as long because the gastrocnemius is really not adapted for long-term use. You know, it's an anaerobic muscle as a rule. Same thing with jumping. You know, how do we get our bodies up off the ground? Well, that gastrocnemius is pushing the ankle down so hard and fast that it actually generates enough force to more than the body's weight. So you come up and then gravity pulls you back down. So that's the gastroc. It's the running jumper, running and jumping muscle. Underneath it is the soleus, and the ankle flexion or ankle extension, plantar flexion, is also important in a jog or a casual run too. And here it's the soleus that's doing it. So you don't get this huge power stroke that throws you up into the air like the gastroc does. Instead, you get a pushing force that propels you forward. So the two muscles have different kinds of fibers, and the body uses them differently. So the gastroc is huge, powerful, but it's not very long-lived. It wears out fast, in other words. And then the soleus is just the opposite. It's not as strong, but it can go a long time. All right. So let's look at those two ankle extenders.
Gastrocnemius is the large superficial muscle occupying the posterior compartment of the leg. Gastrocnemius has two heads, the medial head and the lateral head. The origin of the medial head is from the posterior femur, superior to the medial condyle. The origins of the lateral head are from the lateral condyle and the posterior surface of the femur. As they pass inferiorly, the two heads converge and give rise to the calcaneal tendon, which inserts onto the posterior calcaneus.
Also called the Achilles tendon.
Gastrocnemius plantar flexes the foot at the ankle and assists in flexion of the leg at the knee. It is innervated by the tibial nerve.
All right, so the Achilles tendon, or that tendon at the back of your ankle, is actually the combined tendon of the gastrocnemius and the soleus. Their tendons merge as they attach to the calcaneus, which is the heel bone. All right, let's look at the soleus underneath.
Soleus is located in the posterior compartment of the leg, deep to gastrocnemius. The origins of soleus are from the proximal one-third of the posterior fibula and the soleal line of the posterior tibia. Soleus passes inferiorly and merges with the deep layer of the calcaneal tendon, which inserts onto the posterior calcaneus. Soleus plantar flexes the foot at the ankle. It is innervated by the tibial nerve.
All right. So that's the gastroc and the soleus. So you know I like to talk about our four-legged friends, right? So when you look at a dog or a cat's leg, or feel it in particular, you can feel their Achilles tendon or calcaneal tendon is much longer, and it's kind of visible. It certainly is palpable because remember, when they're standing, they're on their toes, so their heel is that first bend. Oftentimes people think that their heel is actually their knee, and the reason for all that is by having being up on the toes like this and having this long tendon with its very fast, strong muscle at the end gives them a mechanical advantage when running. So maybe you've seen the fancy stilts that people run on. They have a curve to them, and people can actually run faster with those. They got that idea by looking at animals and the fact that they run on their toes with this with a long lever essentially attached. So just a little comparison. My cat gets examined quite often because I'm fascinated by it. All right, so this is
the origins of tibialis.
This isn't in the front now. This is the tibialis anterior muscle, that one that you can feel just lateral to the tibia on the front of the calf.
The origins of tibialis anterior are from the lateral condyle of the tibia, the shaft of the lateral tibia, and the interosseous membrane. The insertion is to the medial and plantar surfaces of the medial cuneiform and the base of metatarsal 1. Tibialis anterior dorsiflexes the foot at the ankle and assists in inversion of the foot. It is innervated by the deep fibular nerve.
And is essentially the only muscle in the anterior calf. Almost all of the muscles in the calf are posterior. Because underneath the soleus, there are many other smaller muscles that work in the foot. But the tibialis anterior is the only one in the front part of the calf. All right, so just like the hand, inside the foot itself are also some muscles, and we call these the intrinsic muscles of the foot. And they're for the toes. They move the toes. So we'll have flexors and we'll have extensors of the digits or the toes found on both sides. So we have the flexors and abductors are found on the sole side of the foot. So here we're looking at the sole of the foot, the inferior side. The extensors are found on the top of the foot. So we'll see the extensors here and the flexors and abductors here. And then just like the hand, there are lumbricals which move the first phalanges against the metatarsals down there. So it makes that kind of a motion, but only in your foot. Now, wrapped around the anterior surface of the ankle is a tough band of fiber called the extensor retinaculum. And essentially what this does is it makes sure that the tendons, as they're coming down from the calf and into the foot, they have to make a bend, right? Because the ankle, here, let's just draw it. If here's the calf and here's the foot, there's a bend here. So the extensor retinaculum sits right here, and it makes sure that the tendons that are coming down make this bend. If you were to cut this, what you'd see is when you went to dorsiflex, you'd have these tendons that would pop out at the ankle, and we call that bow stringing because this kind of looks like a bow, like an archer's bow. So the extensor retinaculum keeps things put. We didn't talk about it, but there's one in the hand too. So along the top of the wrist, there is also an extensor retinaculum that makes sure that the tendons bend instead of come out from the skin. So we have those in both places. All right. All right, so we're going to do a few questions, and then we're going to call it a day, even though we're early. So, All right, flexion of the hip is a movement produced by which of those? Remember, flexion and extension, so think before you answer. All right, I got quite a few of you on this one. Flexion of the hip is that. Remember, that's kicking a ball is flexion, and that's the iliopsoas muscle that does that. The glutes are very famous, so a lot of you picked A. The gluteus, maximus, and medius are extensors of the hip. They make the hip straight and hyperextended. Flexion is the psoas major and iliacus. All right. Which of the following is a part of the quadriceps femoris group? So answer this one, and then we'll call it a day. Because I can tell that you haven't studied your muscles yet. All right, so the correct answer there is C, the vastus lateralis. The quadriceps are the rectus femoris, lateralis, medialis, and then intermedius. All right, if you like the muscle videos, I do, in case you couldn't tell. They're online, and you can look through them whenever you want, and the quality is much better. The ones online are higher quality, higher definition than the ones I have for the screen. So if you're a visual learner, please use those.
They're on Angel?
Yes, they're on Angel. All of them are.